Thanks for joining us for another episode of Boom and Bust. I'm your host, Tony Clement. I'm here at the News Forum where all voices matter. Today, we're pleased to have on the program Dr. Chandana Unnithan. She is the Chief Scientific Officer at Lifeguard Digital Health and an expert on blockchain, tech, and digital healthcare. Welcome to the program.
Thank you for the opportunity.
So I guess I'm going to have a general question to start off with. What are the trends in digital healthcare right now?
We are looking at digital health trends, including decentralized and bringing it closer to the clients, bringing mobile solutions and edge computing, blockchain, IoT solutions. These are the trends, particularly in the digital health.
So, and what's driving these changes, Doctor? Is it patient demand or governments or just innovation? What's going on here?
I would actually say it is driven by all of these. So it would be primarily the digital revolution has reached had really far-reaching consequences, particularly after the pandemic, when people were, even though there are technologies available, they were not being used at the utmost possibilities. They were not leveraged. And people do know that it is available, and there is obviously the demand. And it is also another area where it's becoming very important is there is a shortage of health workers overall. During the pandemic, we did lose a lot of strength during the 2 years. And that's also driving these changes. So people are wanting to live independent lives, healthy lives, as much as that's possible. At the same time, being in touch with their loved ones, care. As we are all independent human beings, we would like to live freely. At the same time, there is increased awareness that these technologies are available. One of the greatest examples is telehealth. For people who have not been experienced with the telehealth as a solution, this has been a boon in disguise in many, many areas.
So tell us, let's just focus on telehealth just for a second. We'll go to some of those other topics in due course, but maybe just describe to our audience how telehealth is being utilized now to be part of the solution.
So during the pandemic in particular, the telehealth became a solution for instead of going to see a doctor. This is mainly to protect the doctors as well as the patients or anyone who's may or may not be infected, even for other types of care that they needed to. So instead of going to a physician or walking to a clinic, this became an opportunity, even more so because you could use a computer, sit in your living room, not go out, and still talk to a physician as you wanted. Although reluctant at the beginning, this became a very important tool in the hands of the public. Another important area, if you look at seniors and telehealth, if you go to any pharmacy, most of the time the scripts are being offered in the pharmacies. Most of the people who are waiting are senior citizens. If these senior citizens could be at home and still order, talk to a physician, and even get connected eventually to an online pharma where the script can be reached home rather than them going out. Wouldn't that be wonderful?
And just to be clear, a lot of this technology was in some form available pre-COVID, but COVID really accelerated this, did it not?
That's correct. One of what these technologies did exist, and it was probably it was not integrated. So when we're looking at telehealth integration with online pharma or any other forms and bringing it all together into e-health records, which go nationally or similar, it becomes very important that solutions are integrated, and that is the power of technology. also comes with a lot of inhibitions regarding privacy, security, integrity of data, hacking, and so on.
Yeah, and we'll definitely touch on those topics. We're going to take a brief break with our guest. We'll be back after that. Please stay with us.